Thank you for coming to I believe this is our last Hyde lecture of the year, and the best one by far. I'm Dan Pietkowski. I'm an assistant professor of community and regional planning, and I'm excited to introduce our speaker tonight, Noreen McDonald. She is the chair of the Department of City and Regional Planning at UNC Chapel Hill. She holds the Thomas Willis Lambeth Distinguished Chair in Public Policy, and she's also the director of the Carolina Transportation Program and associate director of the Collaborative Sciences Center for Road Safety and the Southeastern Transportation Research, Innovation, Education, and Development Center. Her research examines how investments in infrastructure, such as schools, roads, and bike lanes, influences travel decisions and the downstream impacts of those decisions on safety, health, and city structure. Her work considers how these relationships differ across space and demographic groups and how new technology may disrupt these relationships. So please join me in welcoming Noreen McDonald.
All right, great. Well, thank you very much. I'm excited to be here. It is my first time getting to visit the state, so this has been nice, and I particularly appreciate the temperate weather. So what I wanted to talk to you about today is to sort of think about what's going on in our cities because of changing transportation technology. And I think some of this we've already experienced. Everybody here has probably used Uber and Lyft or bike share or e-scooter or e-bike or something like that. And we also see a lot about autonomous vehicles. Obviously not really here, but in some ways on the horizon, and a technological change that could reshape our travel needs, how we travel, and then ultimately how our cities need to function. So I think it's kind of a unique time to reconsider the transportation system. So what I'm going to do today is go into a little bit more depth about why I think it is this unique time, and I sort of term it a time of uncertainty here around the transportation system. Some of that relating to this emerging technology, but some of it just relating to long-term demographic trends. And then think about how planning might deal with this time where where we have an opportunity potentially for big changes, and look back at how we've dealt with some of those in the past. We'll briefly look at urban renewal, which is probably not a high point of planning practice. But I think it is important to consider when we start to see visions of how technology can solve our vexing societal problems like congestion, like roadway fatalities. And we need to start asking questions about what the role of planners and what the role of designers are during this time of change. And so then I'll get into what's needed. I'll talk about some work I've been doing with a colleague, thinking about what is an epistemological basis for us to approach this time of uncertainty. And then I'll talk about case studies. Depending on time, I'll go into one or two, thinking about some of my own work along with my collaborators. So I'll talk about a project related to pedestrian fatalities and autonomous vehicles, and how autonomous technology could provide a solution to that very difficult problem. And then potentially, depending on time, we'll also talk about emerging technologies like Uber and Lyft and how they relate to getting people to medical care. And then I'll wrap up from there. Okay, and then I'll try to make sure I finish so that we have about 10 or 15 minutes or so at the end for questions. Okay. All right, so I said I'd start by talking about why I think this is a kind of unique time, a time where we're facing really deep questions, where I think if you asked me or asked most people who think about transportation exactly how we're all going to be traveling 10 years from now or 20 years from now, I can kind of shrug. I'm not going to be able to give you an answer to that question with any degree of certainty. And that's somewhat problematic because we plan our transportation systems by forecasting how we're going to travel out 30 years from now. So I don't believe any of those forecasts, but we have a lot of people producing them, and we're making investments in roads, transit, and bike lanes based on those forecasts. So what I'm going to talk to you about is look at some of these sources of uncertainty. The first one, thinking about behavior, and I'll also get into technology as well. So thinking about behavior, so I said we make these forecasts all the time. So the black line here starts in 1965 and is the actual level of road traffic in the United Kingdom. And so what you can see is fairly high rates of growth in the 60s, 70s, early 80s, and then you see the growth starts to attenuate and sort of stagnate up till now. The colored lines are the forecast that the planning agencies in the UK had for road traffic. And what you can see is they largely presumed that the trend of rapid growth would be continuing, right? And so the forecast didn't do a very good job of predicting what the actual traffic was going to be. I'm not trying to pick on the UK, it's just that they actually have a national travel model. In the United States, we don't. We do it region by region, so it's actually a little bit easier to compile this type of data for the UK than it would be for the US. Why is this problematic? Well, we've just way overestimated how many cars are going to be on the road, and presumably we built a system to accommodate that traffic that may not have occurred, right? So what's going on here? There's some big demographic shifts that drove those rapid increases in the 60s and 70s, auto ownership going up very quickly. Once you get to about 1 car per driver, it's hard to go past that, right? Or at least it's hard to use those vehicles. So that's some of the reason why we have stagnation. Similarly, women were entering the workforce in much higher numbers in the 60s and 70s. Again, we've largely sort of hit saturation in that trend, and so that's some of the reasons we see that pattern there. So there's these large-scale demographic shifts which are kind of changing the behavioral patterns, meaning we're tending to get our forecasts a little bit wrong. We also have a conversation about whether there's generational differences. So I've done some work looking at millennials and how they compare to other people. Several other groups have been working on this question as well. What we see, I think, is really that there's, again, a long-scale trend that people are delaying partnering, delaying having children, investing in education more. And what that means is that people in their 20s today are going to travel differently than people in their 20s a few generations ago, mostly because they may not be going to work, they may not be carting children around. And so we do see generational differences, not so much because millennials are so different from Gen X, but just over time, we are all putting off these life milestones. And then, of course, we do have macroeconomic factors sort of moving our travel up and down, gas prices, the global financial crisis, the recent recovery. If coronavirus sort of comes, obviously we're going to see huge drops in mobility. So all of these other factors as well make it very difficult to think about what transportation is going to be like in the future. We also have a changing set of travel needs that are largely influenced by the advent of technology. So most of you, how many of you have ordered something on Amazon in the past week? Right, like probably a large proportion. And that means you might not have gone to Target. Maybe you ordered it from Amazon, or maybe you ordered it from Target's website. Some trips are going away. Similarly, we're able to work remotely much more easily. The technology companies like Uber and Lyft and Amazon provide ways for people to work as independent contractors. That's also shaping the trips that people are making in somewhat controversial ways as we move away from a model of a full-time employee to the gig economy. But again, these are trips that would have been made which are no longer happening. And then the big one, the one that the conversation has mostly been about, is new technology and how that's contributing to this uncertainty about how people are going to travel. So here's just a few companies that are operating in this space. You can see, I think Uber's the sort of earliest one, 2009. That's not really a long time ago. And so Uber and Lyft, starting essentially with a kind of smartphone taxi, now providing pooled services, e-bikes, e-scooters. Via, I don't know if everybody's familiar with that, they're a microtransit provider. So in large markets, You can sign up and say, I need to get to work every day. I want to kind of buy into a transit route. So it's actually a private company providing something akin to a bus route. In smaller markets, they partner with transit agencies. And then, of course, you have Bird and Lime, which are the e-scooter companies. So all of these options, if we were looking, none of these would have been up there in 2000. We would have basically had taxis, right? And so these options are shifting, and they're important. They're called disruptive technologies because they start to provide an opportunity for people to think about whether they want to invest in a vehicle in that fixed cost, or whether they want to make a decision on a trip-by-trip basis on which way to travel. Do you want to take an Uber for this? Can you scooter for that? Whatever it might be. Where I live in Chapel Hill, I would assume is probably a little bit similar to here. We don't have very high levels. If I want to call an Uber from my house, it's probably going to be 10-ish minutes. That's not quite good enough service for me to give up my car. But in some larger markets, the wait times are relatively short to the point where people can actually think about changing their behavior. And then, of course, the big new option or possible option is the autonomous vehicle. From the scientific vision shown here, where we could play cards or watch a movie or whatever it might be as we sort of frictionlessly travel wherever we need to go so that our time in the vehicle can be productive. These people seem to be having, it's actually not a family. It seems to, I think they're having cocktails in the car, perhaps. But this is the one where people are putting forth visions of utopias and dystopias, places where we can live wherever we want, where we'll be able to have productive work time in the car, places where the cities will be easy to get around because everybody will be slowed down and no pedestrians or cyclists can be killed, along with other visions where we'll just take an autonomous vehicle everywhere because if it's cheap and easy, why wouldn't we? And so this is where I sort of want to insert a little bit, because when we're starting to think about utopian or even dystopian visions of the future, and we're looking at how technology could make large-scale changes in the city, I think it's important to think about what our role is in those conversations. So we'll look back a little bit about thinking how planning, one of the last time there were these visions put forward for radical change in the city, and really what the planning profession's response to that has been. I'm well set up if I get thirsty. If anybody else gets thirsty, you're welcome to have a little bit. All right, so I termed it planning's contested relationship with progress, and what I'm thinking about is the urban renewal program. So the program where the idea was through application of our scientific method, we could understand the problems of the city and essentially conduct radical surgery to achieve better outcomes. So this is a shot from Baltimore, looking at how they would deal with that there. This is an image from New York City's program. So this is 1956, their slum clearance program. These are some changes that they were proposing. So up here, you can see they're basically replacing what was a bungalow community with high-rise housing. It was actually funny, as I was putting these slides together, I realized that was actually near where my grandmother lived when I was a child, so I actually really knew where that was. And she did live in one of those high-rises. But in any case, planning sort of took on this idea that technology can change the city and we can understand cause and effect and we can affect change. What's happened afterwards is a real reconsideration of who's was benefiting from that and who paid the price of it, and consideration that there was essentially a lot of hubris in that process, that all the factors could not be scientifically identified, and there were The pullback from that has been that the planning profession largely left visionary ideas on the table and became very process-oriented. And that has had had a lot of benefits. There's been an emphasis on public engagement, on bringing in many different publics into the process of planning and changing communities. But it's left, in some ways, a vacuum around visions for the city and putting forward ideas. One of my colleagues wrote about this and sort of talked about wanting a little bit more Robert Moses in his life and a little bit less Jane Jacobs, right? And so that inherent tension between those two figures. And of course, the outcome of all of this, of urban renewal, these are the Pruitt-Igoe houses in St. Louis, right? After all this investment, many of them have been torn down since. This was merely 20 years after they were put in place, right? So a huge investment by the federal and state governments that was largely now seen in many ways as a failure and pulled planning back from this idea of radically changing the city. But if we're at an opportunity where we see radical shifts coming in how people travel, and we know that transportation is intimately linked to the form of our cities, right? The most obvious example being if there's autonomous vehicles going around everywhere and they don't need to park, well, we don't need a bunch of parking lots in a city, right? We can have major new developments there. You can start to think through all of these things. How can we then approach it as a field? And so one of my colleagues, Bill Lester, has been writing on this, and he's looked to the work of a neo-pragmatist called Richard Rorty, essentially to try to say that bringing some humility, but also bringing hope to the equation is critical. And so what the hope means is thinking that there can be process, that it's okay to have visions for the future. And so what he talks about here is to think of progress as the ability to solve not only the problems our ancestors solved, but also some new problems. What are those wicked problems? What are those vexing societal issues that we have not been able to solve? Roadway fatalities, congestion, access for people who don't drive, right? We have significant, huge issues. How can we leverage this technology to address those? And focusing on, in some ways, incremental progress as being acceptable. And so thinking about this, though, particularly when we reflect on things like urban renewal, where there were clearly, the costs were borne largely by the poor and disadvantaged, and the benefits largely went to the elites, how do we think about having just outcomes when we're also talking about making large-scale change? And so what Rorty talks about is this idea of expanding the sense of us, and that we can do this incrementally. That over time, we hope to get it to a better place. We don't have to all at once get there. What we are looking for is this next vision of our transportation future to solve some of these old problems, and also to think about who's going to benefit from that. To be thinking not just about how we and our groups, the us, but to expand the sense of who us is as we consider the costs and benefits. And so Neo-Pragmatism, right, basically holds as a tenet that there's not an objective truth. Truth is made through as we work to address a problem. And I think we can see that as we think about the city future, that through working together and trying to make incremental progress, we shape that future. A lot of transportation planning acts as if we predict traffic 30 years from now, and then we build a system to accommodate it without thinking that the actions we take today shape the demands that we'll have 30 years from now. All right, so that's the background that we're working with here. We have new technology moving in that gives the possibility of solving big problems. And we have a planning profession that has become scared of, in some ways, of engaging in some of these big topics. And so what I'm going to talk to you about now are two research projects that we've done where we've tried to think about how technology can solve some of our big problems. And then we've essentially left a but. And we'll talk about what are these unintended consequences. who might benefit, who might be hurt by the changes. So the first one is around pedestrians and autonomous vehicles. And so this is probably the oft-cited benefit of autonomous vehicles. Right now, we have about 35,000 people killed on our roads. In 2018, there were over 6,000 pedestrians killed on our roads. And this rate has actually been increasing even though walking isn't really going up, right? So it's a significant problem. And so the basic premise is that according to the National Highway Traffic Safety Administration, the cause of most crashes is us. 94% of crashes have driver error as the most proximate cause, right? So perhaps the light was a little bit low, I didn't see the pedestrian in the roadway, I was unable to stop in time. And so the idea is that if you take humans out of the loop, perhaps an autonomous car could do better than we did, right? That's the hope. That's how autonomous vehicles could work for us here. And so the way that these vehicles could do better is because rather than the sensors that we have, which are largely our eyes, which work awfully well, but not so great in low light conditions, that these vehicles have multiple sensors on board, so LiDAR, radar, as well as cameras. And most vehicles you go out and buy today actually already have these sensors on board. What they don't have is the computing power to be integrating all of the feeds to actually operate the vehicle without human assistance. So what you can see is LiDAR, that's the system that tells you, if you have a car that tells you brake, brake, or stops beeping at you, that's LiDAR working for you. Radar is used in adaptive cruise control, so you just follow 3 or 4 car lengths behind. Cameras are used for lane departure, so most vehicles today, if you went and bought one, you can usually, if you're on the highway, put it in adaptive cruise control, put on your lane keeping assist, and it will, in a quasi way, drive you on the highway, although it will want you to keep your hands on the wheel. And so these are the technologies that will be part of those autonomous vehicles and will ideally make them better able to react than we can. So using that, they'll be able to detect these various objects in the frame. Of course, they are not there perfectly now. This is sort of meant to be a humorous image. So this is what the image processing systems were detecting. So obviously they misrepresented. They saw the pictures on the back of the minivan that are pictures of bicyclists, and they captured them as bicyclists, which is close, but not quite there. I also saw an interesting presentation from somebody at Carnegie Mellon, and they were looking at when image processing systems got pedestrian detection wrong. And so if there was a pedestrian standing next to a street light, they often did not detect the person, because I guess two sort of tall, skinny things look kind of similar. The other thing that they found was when people were wearing shorts, they were often not detected as pedestrians. So as I said, this was Carnegie Mellon. So if you think about what the training data might be like for Pittsburgh, most of the year you're not walking around in shorts. And so apparently they weren't so good at recognizing pedestrians based on that. So what we did was go and say, let's do a very simple study. Let's look at what might happen if instead of humans driving in 2015, autonomous vehicles had been driving. So we went and we got the records for all the crashes that resulted in a pedestrian fatality in 2015. And we looked at the specific conditions and the cause of the crash. So we could see, did the crash occur because light was low, right? So a person might not have seen the pedestrian, but the various sensors on an autonomous vehicle should have been able to see the pedestrian. So that's a fatality that could have been prevented. We could also see situations where actually an autonomous vehicle would not have been able to prevent the crash. So vehicles, even with very advanced sensors, are going to still have a certain required stopping distance. They're not going to be able to stop instantaneously, which means even if you detect a pedestrian darting out, you might not be able to stop the vehicle in time. So we went through all of those crashes that occurred in 2015 and essentially said, could this crash have been prevented or not? And could it have been prevented with just a camera, or camera plus LiDAR, or camera, LiDAR plus radar? And what we were able to show is that any one of the sensor systems doesn't operate particularly well. But if you put the systems together, so you have on board a camera, radar, LiDAR, and even ultrasound, you can estimate that over 90% of the pedestrian fatalities could have been prevented if an autonomous vehicle had been driving rather than a person, right? And so this is, I think, a positive message. It is also one that has a huge caveat to it, which is we presumed that the technology was operating perfectly, which it is not doing today. And so we have then, this technology has that promise of solving that vexing old problem, that huge road safety problem that we have. But then we asked, what else? What else might be some unintended consequences, particularly as we're deploying this technology? Who might be benefiting, and particularly who might not be benefiting? So one of the first things we noticed when we looked at this data was that where pedestrians fatalities occur and where we anticipate that autonomous vehicles and connected technologies will deploy first and most readily are not perfectly matched. And so what do I mean by that? Well, first off, nearly a quarter of pedestrian fatalities occur in rural areas. And I think most people expect that rural areas will probably be some of the last to have AVs deployed, because you need very well-marked roads, you need very well-mapped roads, because the vehicles are using GPS against a mapped database. We also can see that even when crashes are occurring in urban areas, they're largely not occurring at intersections, and intersections are some of the places where we're putting a lot of this connected technology to connect both the vehicles, but also the traffic signals and the roadway infrastructure. Similarly, we expect that AVs will deploy most easily on interstates and then eventually on arterials. Again, most pedestrian crashes are not occurring there. So what we have is a potentially incredible advance in road safety, but we know that that advantage will not come right away, even once these vehicles are deployed. We also know that the mere presence of autonomous vehicles will probably change how you and I behave. Right now, most of us, when we're crossing the street, kind of look at the car and try to guess whether it's going to stop, right? And if we don't think it's going to stop, we don't go into the crosswalk. But if we know that a vehicle's been programmed to stop, we will probably fairly confidently cross the street. So this idea of playing chicken with an autonomous vehicle, or sometimes I've been at conferences and had people worry about the autonomous vehicles being bullied by pedestrians. So in any case, but I think it is reasonable to assume that we will act differently, and you can view that whether you think that as a positive or a negative. And I think the question that we have to think about here, the potential unintended consequence, goes back to then, who will have the right to cross the street, and where will they have the right to cross the street? And so I want to look back again a little bit at history and think about, we had another huge transportation technology come on, the automobile, and it really changed who was allowed to use the road. So when cars first came on the road, there was a huge increase in child pedestrian injury because the cars were killing children that were playing in the streets, because it was perfectly acceptable prior to that for children to play in the streets, particularly in cities where there's a limited amount of play space for them. If you think about a lot of the games that people talk about from that time period, right, they're based on sewer covers and stuff like that. It meant that kids were in the street. And so what occurs is there's a campaign to essentially slow down the cars, and then the auto industry responded by essentially changing the narrative and reconstructing who is allowed to be in the street. So the term jaywalking, which all of us are very familiar with and understand that it means, pedestrians need to cross in certain places, it's actually introduced during this time period in the 20s to signal that pedestrians don't have the right to be in the street at all times. And so the question that we're looking at with autonomous vehicles is, will we create a place where pedestrians will be able to safely cross, or will we be very focused on vehicle throughput and not want the pedestrians to slow the autonomous vehicles down and thereby zone pedestrians out of certain areas? And so I think what I would say, again, the role for the planner is to sort of envision this possible future and think about where are the places where we might want to ensure that all people have access to the road, maybe the downtown cores of city, and also recognize other places where vehicle throughput is maybe paramount. These might be arterial roads on the sort of peripheries of communities, but that those conversations about who has rights have to be fairly explicit. All right, and so the next case study that I wanted to bring to think about how emerging technology can solve some of our current problems, but maybe some of the problems that we need to be thinking about as designers and planners when they're implemented, is around ride-hailing and medical access. And so ride-hailing, I mean Uber and Lyft. So we know that missing care or delaying care leads to adverse health outcomes. That means both for the individual and then for society, the costs are often heightened. So perhaps the simplest example is if you require dialysis, if you miss that dialysis appointment, you could potentially end up in the emergency department, which is obviously much worse for the individual and much more expensive. One of the doctoral students that I work with is focusing her dissertation on this, and she's recently completed work that's going to be coming out in the American Journal of Public Health, looking at how many Americans report transportation barriers to care. And so it's about 2 to 3% of the population reporting barriers, around 6 or so million Americans. And the way the question is asked, it said, did you have trouble reaching an appointment? So we know that that's likely an underestimate, because if somebody didn't need to seek care, they wouldn't necessarily answer yes to that question. So this is a big issue. It's causing both problems for individuals' health outcomes as well as the cost of our medical system. And we have a lot of solutions to this problem, right? We have taxis, we have community volunteer drivers that help people get to medical appointments. Much of our paratransit system, so this is the system that's a demand response system that all transit agencies are legally required to provide. If you qualify, you can usually call up a day in advance and say, I need to go to my dialysis appointment, and they will send one of these little buses to pick you up and bring you to that appointment. And so these systems are in place. They've been working. There is funding for this, so both from the Federal Transit Agency to support access and also through the Medicaid program, non-emergency medical transportation is a covered benefit. But some of the ways I described this, calling up 24 to 48 hours in advance to schedule your appointment, being required to get on a bus that's a shared ride and potentially spend a very long time. So we often provide this access to medical appointments, but in ways that are incredibly time-consuming for people and may make it difficult for them to work or difficult to participate in other important aspects of life. This has not gone unnoticed by Uber and Lyft, who have identified this as a fairly large business opportunity. This is medical transportation, non-emergency, so this is not ambulances. Non-emergency medical transportation is $1 billion business, and these companies are actively working on trying to enter this market. And so Lyft has their statement here. Uber introduced Uber Health, and they are actively working in this as well. So here is a really interesting example, this is currently going on. I know the hospital, UNC Hospital, has a contract with Lyft. The Medicare insurer in our area has a contract with Lyft. I would presume the same is true here. Most hospital systems and providers are contracting with these companies. They're doing it for two reasons. They're doing it to make sure that there's better health outcomes for patients. There's also a business motivation for the hospitals themselves. If they need to clear beds, they need to just charge patients, and that patient has no other way to get home, they can now send them home on a Lyft or an Uber. And so it increases bed turnover for the hospital. It also is potentially doing it in a way that's much faster for the individual, right? Uber and Lyft, I don't have to schedule that 48 or 24 hours in advance. In this case, I don't necessarily have to share the ride with anybody else. So it's starting to suggest a model that could also provide better quality of life for individuals. And so this is, ooh, that got a little funky, but Columbus got funding from the Federal Transit Administration and US Department of Transportation focused on decreasing maternal mortality and improving outcomes for babies by increasing transportation to prenatal care. Blue Cross and Blue Shield are working with Lyft to address this idea of transportation deserts. So for some of their subscribers that live in areas where they don't have other options, that Lyft will provide an option in that area. And then this is an example from Boston. So I showed you the image of the paratransit bus earlier. What Boston has done is partnered with Uber and Lyft, as well as a local provider, to move their paratransit services onto those companies. They're doing it on a pilot basis. The pilot has kept being extended out. It's currently, I think, extended through the middle of 2020. And the data that they reported has been quite interesting. They haven't really reported cost savings, but they have reported that individuals that qualify for paratransit are making many more trips at the same cost to the transit agency. And so what that means is people are now no longer have to call up 24 hours in advance. They can do it in real time, just like you or I could. Individuals have to pay some money and the transit agency subsidizes some money, but people are now able to do more things. So with the same level of government subsidy, they're presumably helping people get to medical appointments, get to grocery stores, get to other needed destinations in ways that are probably greatly increasing quality of life. And so our work in this area has really been right now sort of starting to ask some of these questions about who is benefiting from these programs, how are they working. What we do see is that the Boston example of really radically rethinking how paratransit services are provided is the exception. What we more see is that these services are used as Band-Aids. I mentioned a hospital will call a Lyft now if they really need to clear a bed. Well, they used to call a taxi. It's really not so different, right? And so right now, the services are applied in very extreme situations where there is no other alternative. It's much easier for the hospital systems to track or the various medical providers, but it's not really solving some of the worst problems, which is thinking about ways that people who need to access prenatal care regularly can get there more easily, or people undergoing cancer treatment when they have to go more regularly can do that. Or really the most difficult of all is how does this work in a rural area where Uber and Lyft are largely not present? And that for us is the big challenge and where we're focusing our research to try to think about, are there some creative options that could save people time, use the new technology, but also not necessarily cost more? I don't know what the answer to that is, but that's actively where our research is. All right, so I'm gonna wrap up there. What I wanted to try to convince you is that we're coming into a very unique time where technology is changing the options that we currently have, and they're potentially going to be changing them more in the future in ways that can reshape cities, reshape land use. And that planners need to engage and sort of recognize that visionary plans are critical here. This tension between the Robert Moses and the Jane Jacobs is a productive one, and focusing simply on process and planning processes is probably not adequate to the challenge right now. But instead, when I said embracing that tension is important, it's because asking questions not only about the vexing problems that the technology can solve, but questioning who will benefit from that, what unintended consequences might come about, and that neo-pragmatic framework provides a useful way for planners to engage in that. So I'm going to conclude there, and I'm happy to answer any questions that you might have.
Any questions?
Thank you. You mentioned at the beginning that past forecasts have been really inaccurate, and the ones coming out today probably are also going to be inaccurate, but what do they look like? I'm just curious.
They're done, the way they're done is for each region, so you could pull up the one for this region, for this metropolitan area, and see what they are. I think after the global financial crisis, at least what happened in North Carolina, is that a lot of the estimates decreased, but now that gas prices have stayed low for a while, the governmental estimates have been going up. But in the United States, it's region by region.
You mentioned private transportation, but you never mentioned anything about public transportation, like light rail or like metros or like any of that. How does that play into all of this urban planning?
It's obviously a critical part of it, and I think there's a really large literature trying to think through whether these technologies like Uber and Lyft are a complement to public transit or a competitor. And I think the results, my read on the results is that it depends on the market, right? And so in major markets where there really is a requirement for mass transit, right? Uber and Lyft cannot replace the New York City subway, right? That is just not possible. And so there's potentially a complementary relationship. In lower density areas, it's a little bit trickier, right? Where I know in our region, and you may have similar experiments, we have a research park where IBM, GlaxoSmithKline, a lot of large companies are located. It's incredibly difficult for our transit system to serve that area. So they are now trying an experiment, a pilot, where they're actually providing free Uber and Lyft rides. They're subsidizing them, I think, up to $10 per ride. So if you're at the regional transit hub, you can get to your office building. And they did this because it turned out to be too expensive to run buses on a regular route. And one of our students is doing their master's projects looking at the evaluation on it, and the preliminary data is suggesting that it is actually cheaper to subsidize the Uber and Lyft ride than it was to keep the buses going around. And the transit agency is then still benefiting. The individual is riding the bus from Chapel Hill or Durham or Raleigh to the transit hub. So there's an example of a complementary relationship. So I think it's not a simple dualism. It'll depend on specific land use patterns.
I'm just kind of curious if you've done any research about AV's impact on like parking and like what that means for planning, essentially.
So I haven't, but there's really wonderful work on it by Wenwen Zhang, who's at Virginia Tech. And what she's done is model using data from Atlanta. And so with autonomous vehicles, there's basically two futures. One is that we'll own our individual autonomous vehicle, and the other is that there'll be a fleet of autonomous vehicles. And what she's shown is that if there's shared usage of autonomous vehicles, so more of a fleet model, the parking moves out of the downtown areas, but it moves sort of into that first ring just outside. And at least in Atlanta, the way that city is configured, it would likely go into heavily African American and low income areas, sort of raising questions about what the equity impacts of that is. So her work is great on that.
You mentioned that a quarter of them were happening in rural areas and that 80% of them were happening not at crosswalks. So I was wondering what the rest of the percentages accounted for, if it was jaywalking or if you guys found any other trends due to these fatalities.
Yeah, so all of them are just the flip. So 75% in an urban area, 13% at the intersection. So it's a real mix. But certainly mid-block crossing is a huge part of that. And in a lot of areas, that's because if you think about the urban design, often for larger arterials, particularly if they don't have good intersections for you to cross out, you're sort of forced into a mid-block crossing.
So kind of in between the autonomous vehicle and the pedestrian, you showed like there's scooter companies, we know that there's e-bikes. How does the increase in autonomous vehicles, does it allow for a safer experience for that kind of middle ground? Are they considered pedestrians? I'm sure anybody who's experienced one of those scooters, where you're supposed to be using those in the roads, but it's very scary to do that. And it's also scary for the pedestrians to do it if you're doing it where you're not supposed to be. And so how does the middle ground sort of get resolved?
Mm-hmm. So I think the basic ideas of do we want to have, ensure that there's places in our communities where, particularly downtown areas, where there's low speed generally and there's a mix of users, whether that's people on foot or people on a scooter or people on a bike. And so it's not exactly the same, right? But the idea that there have to be the right to the road for people no matter what technology they're using, I think is a critical part of that. You're also seeing this conversation play out in real time, not involving autonomous vehicles, the idea about whether there's a low speed travel network, previously called bike lanes, right now for lower speed vehicles like scooters and stuff like that, and what are the safety issues around that. Some of the colleagues that I work with in our road safety center, they actually just worked with a variety of organizations to make sure that there's now a code that emergency departments can use to code if an individual comes into the ED with a crash from a scooter. So previously there wasn't a code for them to put down what the cause of the crash was. So now there will be, so ideally there'll be better data. But there has been a struggle on the data side with understanding safety issues around scooters.
Any other questions? Yeah.
So with roads being safe with automated vehicles coming around, Uber and Lyft, companies like that being more prevalent in society and how they actually get people from point A to point B, that means you have a lot less people who are actually going to be relying on vehicles, so a lot less people having to pay insurance. And also with safer vehicles around, there's going to be a lot less accidents, which means it's kind of a hassle for insurance companies, which they're going to have to adapt as this goes on, which I'm fine with, honestly. But along with those companies, what companies or what kind of businesses would be impacted by automated vehicles and safer, more reliable sources of transportation?
Mm-hmm. That's a great question, and one that I haven't quite thought through from that perspective. But I think, as you suggest, right, the insurance costs are going to be ideally significantly decreased and probably borne by the fleet operator rather than the person riding in the vehicle. when people talk about the adoption of autonomous vehicles, they also often talk about it being coupled with electrification, so that you have huge environmental benefits. And so that has implications for the current fuel providers as well, and also for the manufacturers, because as we move to more battery-based technology, that facilitates certain companies and locations that are producing that rather than some previous elements of the supply chain when you're using an internal combustion engine.
I was wondering if you've done any research on people calling Ubers or Lyfts instead of as a substitute for an ambulance due to the sheer cost of ambulances.
So we haven't done explicit research, but there's been several articles sort of anecdotally talking about that because it is dramatically cheaper. And it's even, it's not just cheaper for individuals, it is actually cheaper for the system as long as medical needs don't require the ambulance. There's a huge part of ambulances being called because people have no other way to get to healthcare. And so this would be better for everybody in that case.
I wondered if you could talk for a second about starting more visionary conversations with policymakers, with practicing planners and all of that thing, and sort of how that can begin, because there's capacity issues, there's all of these things going on that keep us from having these visionary conversations. So.
Mm-hmm. Well, that's a really great question, a really difficult one. I think in some ways the attractiveness of the technology is actually an insertion point, right? I've had more people interested in talking about transportation around autonomous vehicles than most other things, right? The newness, we can all sort of grasp that these are changing how we might live our lives. And it's not even just the autonomous vehicle, right? The scooter conversation. Everybody goes to a city now, and if they have scooters around, everybody kind of piles on and laughs a little bit. And maybe you think it's dangerous, maybe you think it's useful. But it changes some of those conversations, and I think elected officials are not immune to that. And they're certainly being forced to grapple with it because the question of what should be allowed in cities and how it should be regulated is coming before these boards all the time now.
Any final questions? Yeah.
Just a quick one in terms of the the negative effects of some of these issues. So one, if I can kind of zone out in my autonomous vehicle or do work or get more things done, I can also live farther away from the center, for instance, right? So does it produce sprawl? Or if I show up at my destination and there's no parking, I just send my autonomous vehicle around the block as many times as it takes for me to complete my appointment. So, what are the kind of blind spots, no pun intended, for using autonomous vehicles where we aren't just kind of thinking about the sort of the positivistic side of it, but that it actually could sort of keep producing the same patterns that we've had previous. Like the technology is new, but maybe our kind of human impulse remains the same.
Mm-hmm. Yeah, so I think everybody when they teach transportation, I think we're required to talk about the move from the walking city to the omnibus to the streetcar, and anytime you change transportation technology, all that usually means is you decrease the costs, right? And that means people consume more of it because it's essentially a normal good. And so what that suggests is the role of price to me, right? And so the idea of AVs driving around, if they're not priced for doing that, presumably they will do that, right? And so that's why people are talking about zombie mile taxes, that you have to have some incentive for the system, for the vehicles to find it cheaper to park. Again, well, the parking might be in those first-ring suburbs, which may be less advantaged communities, so there's still sort of issues we have to think through with that. But again, it's like the prices aren't accidental. We either have government mechanisms to raise the costs of certain actions we don't want to see, or to minimize the cost for certain actions we do want to see. But yeah, I think that, that type of thinking is exactly what's essential here. All of these going down different pathways. If we behave this way, what's the world, what's the dystopian world we don't want to fall into, and how do we prevent that?
All right. Well, I guess on that note, thank you all for coming, and let's thank Professor McDonald for coming out.